We start our study of the nervous system with an examination of the basic cell of the nervous system, the neuron, and then from there we're going to go on to the spinal cord. It's interesting, the different approaches by the different A&P textbooks. Some start with the brain and then work their way down to the neuron. I think it makes more sense to start at the neuron and then go to the spinal cord and then finally end with the brain, and that's the way we're going to do it. So the made up of cells called neurons. The neuron is the basic cell of the nervous system. Should have learned that in Bio 156, but let's review and expand. So neuron is the basic cell of the nervous system. Neurons communicate with electrical signals called action potentials. So the word potential might look strange. It really relates to potential energy. It has to do with a difference in potential energy because of a difference in electrical charge on two different sides of the cell membrane. So action potential, just for right now, think of it as a nerve impulse. We've seen it before. We saw when we did the muscles, we saw the muscle action potential. We're going to learn in detail all the parts of the action potential, exactly what it is, but just continue to think of it as a basic electrical impulse, and it is how neurons communicate with each other. The body of a neuron is called the soma, the cell body. The Greek root word soma, somatic, always refers to the body. So the cell body of the neuron called the soma. Neurons have two basic kinds of special processes. One of the things that makes neurons, nerve cells, different than other cells, they have these weird projections on them. So first of all, they have dendrites. Dendrite, the Greek root word, refers to a tree, and in this case the branches of a tree. So look at all three of those diagrams on the left-hand side. See how the soma, the cell body, has all these, looks like tree branches coming off of them? Those are the dendrites. Just keep in mind that dendrites are for input. That's where the neuron receives signals from other neurons. Now it can receive signals in other places as well. But for right now, let's just focus on the fact that dendrites are where input comes in. This is where other neurons talk to any particular neuron. So it's where this particular neuron listens to other neurons that are talking to it. Then, after listening to other neurons, this neuron may decide to send out its own electrical signal, its own action potential, and it sends it out along the axon. Once again, the Greek root word here, like the axon means pole. Like, in a car, the wheels are connected to the rest of the car with the axle. So axon means pole. So notice again in the pictures of the neurons on the left how there are lots of dendrites coming off the cell body, but there's one big long pole. That's the axon, and that's for output. So just get this straight right now. Dendrites are for input, the axon is for output. There are exceptions to that, but that'll get you through. That will work most of the time, all right? Dendrites are for things coming in, axons are for signals going out. Now, the axons of some neurons are coated with a fatty substance called myelin. And each individual, so look in the middle picture there. See how it looks like they have little Vienna sausages? You know those disgusting little Vienna sausages they have at parties? It's like, God only knows what they're made of and what kind of stuff they're inside of that can. But those little Vienna sausages, those are called myelin sheaths, right? So myelin is a fatty substance, and why is the axon covered with myelin? Well, think about it. Think about all the wires for all the electronic devices in your house. Is it just bare copper wire? No, there's insulation on them, isn't there? And that's really what myelin does. Myelin insulates the neurons so that the electrical signals stay where they're supposed to be, so that there's no crosstalk, so that wires don't short each other out, so that the electricity from this neuron that's supposed to go down the axon doesn't end up bleeding over into other cells that it's touching. So myelin insulates, and it also speeds it up. It makes the action potential travel faster. And there are gaps in the myelin sheaths. Notice how, the myelin sheath is not just one giant tube. There are little individual myelin sheaths. The gaps in between are called nodes of, And this is a French word. When you say it, you have to speak as though you're a French person. You have to act as though you're talking down to other people, as though you despise them and they're disgusting and they're inferior to you. So they're called the nodes of right? You have to have that kind of like growl in your voice. On your next exam, actually, I'm going to have you record yourself saying nodes of and you'll be graded on that. All right? You have to have that. You have to have that nice, kind of nose up in the air kind of pronunciation to it. So continuing here, at the very base of the axon, where the axon joins the soma, the cell body, that's called the axon hillock. Hillock means a little hill. So notice, especially in the top diagram there, follow the axon back towards the cell body. See how it gets wider when it connects to the cell body? It's like there's a little hill there, all right? That's the axon hillock. Now, what's the big deal about the axon hillock? Remember, we said that input comes in to the neurons through their dendrites. So the neuron has to have some way of, evaluating all the input. Where does it do the evaluation? In the axon hillock. For that reason, the axon hillock is sometimes called the trigger zone, because it's where the neuron sums up all the input and decides whether or not to send out its own signal, its own action potential. In other words, it decides whether or not to pull the trigger. So the axon hillock is where the input from all the other neurons that this neuron is listening to through its dendrites, that's where it's all summed up and where a decision is made. Neurons really can only make one decision, either fire an action potential or don't. That's really it. It's very binary, either yes or no. And where is that decision made? In the axon hillock. That's where the neuron makes the decision to fire or not to fire an action potential. Exactly what I've just said. We say that the action potential propagates down the axon. It's the only example we'll see in Bio 201 of a positive feedback loop. Once the action potential starts, it's not going to stop until it gets all the way to the end. It's kind of like when you light the fuse on a stick of dynamite. Those things will burn underwater. Once you light it, it's going all the way to the end. Same thing with the action potential. So it propagates. Kind of like, those things where they line up all the dominoes and you hit the first one and then each one knocks over the next one. That's what it's like. The action potential propagates down the axon like a bunch of dominoes, all collapsing and, causing the ball to roll off the thing, which then starts the fan and all those cool videos they have on the internet, Axons end in telodendria. So notice how we said on the cell body there are all those dendrites, those are the branches there. Well, at the very end of the axon, notice there are more branches down there, telodendria. Telo means at the end. So telodendria are the branches at the end of the axon. Right? And at the ends of the telodendria are axon terminals. So axon terminals are going to be where, in the bottom diagram that you see there, they call them synaptic terminals. That's just an alternate term. Those are special because they connect to other neurons, to the dendrites mostly of other neurons. And those are called synapses, and we've seen synapses before. We saw them at the neuromuscular junction. And remember what happened at the synapse? The axon released little chemicals called neurotransmitters, all right? And those are going to bind to receptors on the other neuron. That's how signaling takes place on the nervous system. It's often described as electrochemical. That's because electricity, the action potential, electricity traveling down the axon, it causes the release of chemicals called neurotransmitters. And the neurotransmitters, once they bind to receptors on the dendrites, remember at the neuromuscular junction, that caused the muscle action potential. Well, here it's going to cause a little bit different kind of a signal, or they're going to be called graded potentials. But once again, it's going to cause electricity to flow down the dendrites. So electrochemical. Electricity causes the release of chemicals, and when the chemicals bind to receptors, they cause electricity again. Electrochemical, all right? Makes sense. So let's start looking then at a spinal nerve. These are nerves that emerge from the spinal cord. And nerves, first of all, get this straight right now, are bundles of axons. So remember when we looked at the neuron, the axon was the output part. That's where the action potential propagates. All right, that's what a nerve is. A nerve is just a giant bundle of hundreds or even thousands of axons. Think of, you've seen wires where there are lots of individual copper strands all twisted together. It's the same thing, all right? Nerves are bundles of many, many, many axons. Now, they're organized in a manner very similar to that of the muscles that we've seen before. So groups of axons are bundled into fascicles. Those may be axons that are all going to the same place, all right? Remember how fascicles group together muscles that have similar functions? Same kind of thing can happen here. Fascicles may consist of axons that are all going to a particular muscle or a particular part of a muscle or something like that. The entire nerve is wrapped in epineurium. Remember, with the muscle, the entire muscle was wrapped in epimysium. Mys was the root word meaning muscle. Neur, the root word meaning nerve, nervous system. So epineurium goes around the entire nerve, right? And then each fascicle is surrounded by perineurium. And the muscles, remember, it was paramysium. Well, now it's perineurium, same thing. And remember, with muscles, what was each individual muscle fiber or muscle cell surrounded by? Yeah, it's going to be the same thing here, except with neurium instead of mysium. So what's that going to be? The endoneurium instead of the endomysium, okay? So just get that straight. All right, so let's note then that the spinal cord is covered by protective tissue, all right? Makes sense. The nervous system is very important. It's doing important things for you, so it needs some protection. So the spinal meninges, there are three of them, the dura mater, arachnoid mater, and pia mater, are layers of connective tissue that protect the spinal cord and supply it with nutrients. Now, we've talked about these before. We've mentioned the meninges before early on in the semester, and now we're having to learn the specific names and so on. So dura mater, again, dura means tough, mater means mother. Some people say mater, I don't care. Dura mater, that's the tough mother. And then arachnoid refers to spiders, that's the spider mother. And pia means gentle, that's the gentle mother. So the dura mater is the outermost layer, then comes the arachnoid, then the pia is the one that's right down in the nervous tissue itself. So these are connective tissue, they protect the spine and supply it with some nutrients as well. And they're continuous with the cranial meninges, so we'll see the same thing in the brain. The meninges cover the spinal cord and they cover the brain. By the way, an individual one is called a meninx. So the dura mater is a meninx, so is the arachnoid mater, so the pia mater. All three together are the meninges, all right? It's just like we saw with the bones. Phalanx was an individual finger bone, phalanges was the plural. Now, between the arachnoid mater and the pia mater is the subarachnoid space, which contains cerebrospinal fluid. There are other spaces as well, but I'm going to wait until we get to the brain to talk about all the spaces in detail. But for right now, just keep in mind that the subarachnoid space is underneath, subarachnoid, underneath the arachnoid mater, and therefore above the pia mater. And it contains cerebrospinal fluid. CSF, we'll abbreviate it, we can get used to that. That's a watery-like substance that's full of nutrients, and it does a lot of things. We're gonna talk more about CSF later. It cushions and protects in and of itself, but it also carries nutrients and carries waste products away, so it's very important. And you may have heard before of somebody getting a spinal tap. Spinal tap, the more official name would be lumbar puncture. This is where a needle is inserted into the subarachnoid space in the lumbar region to withdraw CSF or to administer medication. So they normally go in down, as you can see the diagram on the right. In between there we're seeing L4 and L5, maybe between L5 and S1. So the needle is going to go in there and they have to go through, think about it, they've got to go through the dura mater, and then there's a space under the dura mater called the subdural space. Then the needle has to go through the arachnoid mater, and then it will go into the subarachnoid space. So some of you, in past semesters, I've had students in my class who witnessed lumbar punctures. So it's a relatively, it's not an unusual procedure at all in the hospital. Again, oftentimes if they need to look at your CSF or administer medications, that's what they'll do. It's always fun too, because it takes some skill to get that needle in there. I've heard former students of mine who are physicians say, yeah, you insert it in there and you feel a little resistance. There's kind of like a little bit of a pop when it goes through the dura mater, and then you feel a little bit of resistance again, and then you know you're through the arachnoid mater. But it's easy to miss. Sometimes it takes 3 or 4 tries. It's funny, when somebody needs a lumbar puncture, you can see the doctors going like, oh geez, I forgot I got a meeting. Get the resident. Let the resident do it. And I've heard that if nobody can do it, then they'll normally go get the anesthesiologist, because they're the ones that have to do this probably more often than anybody else. So let's take a look here then at some external anatomy of the spinal cord. There are 31 pairs of spinal nerves. There are 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Now, something about those numbers should look funny to you. Something should not look right about that. What's wrong there? Think in terms of the vertebrae. Yeah, there are only 7 cervical vertebrae, but there are 8 cervical nerves, okay? But other than that, it's the same number as the vertebrae. It makes it easy to remember. So nerves to and from the upper limbs form the cervical enlargement. So if you can see in the diagram, that's the centralmost diagram there, the spinal cord gets kind of wider up in the cervical region. That's called the cervical enlargement. It gets wider because that's where all the nerves are emerging. We're going to see later on whole bunches of spinal nerves emerge there, and so it's wider. All right, and then once again down in the lumbar region it gets wider because a whole bunch of nerves all emerge down there. Notice in between those two is going to be the thoracic region, and in the thoracic region the nerves come out one at a time, but they come out in bundles in the cervical region and in the lumbar region, and so that's why there are the wide spots. Those are called the enlargements, cervical and lumbar enlargements. Now the spinal cord tapers down to a little cone shaped structure called the conus medullaris. Medulla is a root word that means the marrow or the core, and it oftentimes has something to do with spinal cord, not always. But what happens is the spinal cord basically ends in the sense that it comes to a point, and it looks kind of like an ice cream cone. You can see there in the bottom right illustration, it has that ice cream cone type of shape. So that's where we have the conus medullaris, and below that are whole bunches of individual nerve fibers hanging down. And to the anatomists who first looked at this, it reminded them of all the hairs that form a horse's tail. And so they called it the horse's tail, except they used Latin because Latin was the language of science. So it's called the cauda equina. Cauda means tail, equina means horse. So it's kind of like the spinal cord proper ends at the conus medullaris, and then a whole bunch of individual nerve fibers hang down, and those are the cauda equina. And then likewise, extending from the conus medullaris right down in the middle of the cauda equina is the filum terminale, the terminal filament, the filament at the end, and that basically just supports and stabilizes the bottom of the spinal cord. Goes all the way down and attaches down to the sacral coccygeal vertebrae down there. So let's continue here by looking at some external anatomy here of the spinal cord. Most spinal curves occur on both left and right sides. They're paired. So, it makes sense because we have bilateral symmetry. You've got a left arm, you've got a right arm, you've got a left leg, you've got a right leg. Most spinal nerves emerge on both sides of the spinal cord. We have a left one and a right one. And furthermore, most spinal nerves carry both motor and sensory information. So we haven't really formally defined these terms yet. Motor, you can probably guess here. Motor is going to be signals that cause movement, or that cause the release of hormones by glands and things like that. Motor means it's causing some activity, causing something to happen. Whereas sensory means information coming in through your senses. In particular here with the spinal cord, it's going to be a lot of skin senses. You know, think on your arm. You can feel temperature and pain and pressure and stretch. That sensory information is coming in through a nerve going to the spinal cord. So most spinal nerves have, remember what's a nerve again? Tell me what a nerve is. A nerve is a bundle of axons. So some of the axons in that nerve are sensory axons coming from the body going to the spinal cord. Other axons are motor axons. They're going from the spinal cord out to the body. And most spinal nerves have both motor and sensory information. There are a few exceptions, but think of what's the normal case. Most of them have both. Now, bundles of axons called roots connect each nerve to the spinal cord. So look in the diagram there. You can see where the roots are, all right? So the spinal nerve appears to branch as it gets close to the spinal cord, and we have a dorsal root and a ventral root. Dorsal and ventral meaning the same that they've meant the entire semester, all right? So the dorsal root on the back side, the ventral root on the front side. Now the dorsal root is all the sensory axons, all right? So remember we said that the spinal nerve had axons, for some of them were motor, some sensory. Well, they're all bundled together when they're in the nerve out in your body, but once they get near the spinal cord, they split up into the two roots. So the dorsal root has all the sensory axons. We use the term afferent, and get used to that. Some people say afferent. I don't care. You pronounce it your way. And the ventral root is motor. It's efferent. You do need to know those terms. I remember all the way back, God, 50 years ago or whatever, when I first learned these, I made up my own little thing in my head. Afferent was for approaching the spinal cord, and efferent was for exiting the spinal cord. I don't know if other people use that or not, but I do, and you can if you want to. So again, sensory axons are afferent. This term is not ever going to go away. We're going to see it over and over again. So the afferent axons are approaching the spinal cord. Those are sensory. And the efferent axons on the ventral side are exiting the spinal cord. Those are carrying motor signals out to the body to cause movement and things like that. Now notice the dorsal root has a bulge, a swelling. That's called the dorsal root ganglion. So a ganglion is a collection of nerve cell bodies, of nerve somas, that's outside of the central nervous system. So notice that's not inside the spinal cord, it's on the outside of the spinal cord. So that's called a ganglion. And because that ganglion is on the dorsal root, it's called the dorsal root ganglion. That's where the cell bodies of all the sensory neurons are. Okay? Cell bodies are right there in that ganglion. Now, a little trick that I made up for myself, again, in order to try to remember, you're thinking, wait, which side's sensory? Is it dorsal or ventral? What is it? So, what I taught myself was, what sound does the race car make? You know what sound the race car makes. It goes vroom. And why does that matter? That's because the ventral roots are motor. And that helps me, and I've never forgotten it. I made that up in my own head, 50 years ago, and it still sticks there. The ventral roots are motor, all right? And therefore the dorsal roots are sensory. That's a cool car, too. All right, let's look at some more of the structure of the spinal cord. So there's both white matter and gray matter. And of course, in this diagram, did they make it white and gray? No, they didn't. They made it kind of a lemon custard and kind of a dog vomit brown. So the lemon custard is white matter, and the dog vomit color is the gray matter. So we'll talk about this many times, but white matter is mostly just myelinated axons, where the gray matter is cell bodies and dendrites and unmyelinated axons. So what we have here is there are creases on the front and back side of the spinal cord. See how there are creases there? Big creases. So the big crease on the anterior side is called the anterior median fissure, and the crease on the posterior or dorsal side is the posterior median sulcus. So sulcus means a groove. A fissure is a really wide sulcus. So that's another way when you look at the spinal cord, you always orient yourself. Which is the front, which is the back? We already learned an easy way, didn't we? To look at the spinal cord and immediately know which is the front side and which is the back, right? The dorsal root ganglion has to be the dorsal side. If for some reason you can't see it, you can still look at the two cracks there, the two creases. The big wide one is the anterior median fissure, so once again, that's how you know you're on the anterior side. Now notice how the gray matter forms kind of like an H or a butterfly, whatever, you know, use your imagination. You can find things in the clouds, you can do this. So there's a hole in the middle, that's the central canal of the spinal cord. And that is full of cerebrospinal fluid. That's a conduit, it's a pathway for the flow of CSF. And the little connector, you can think of, you know, like it's a butterfly, it's got the wings on both sides. The connecting part in the middle is called the gray commissure. Commissure means connector. So, all right, so you see the H shape there. You've got the gray commissure. In the middle of the gray commissure is the central canal. That's where CSF is flowing. Now then, notice how the wings, we can talk about them as horns. Again, use your imagination. So we have the ventral horns and the dorsal horns. Now, the ventral horns contain somatic motor nuclei, whereas the dorsal horns contain cell bodies only of what are called interneurons. What we have here, remember, well, we may not have talked about it yet, but we have sensory neurons, we have motor neurons, and they connect to each other through what are called interneurons. So notice the cell bodies, remember we talked about this a moment ago, the cell bodies of sensory neurons are in that dorsal root ganglion. Where are the cell bodies of motor neurons? They're in the ventral horn. And notice how the dorsal horn of the gray matter is skinny and narrow, and notice how the ventral horn is big and wide. Why is it big and wide? Because that's where the cell bodies of the motor neurons are. Cell bodies of the sensory neurons in the dorsal root ganglion. Therefore, there are hardly any cell bodies in that dorsal horn, only the interneurons. Where the ventral horn has got lots of cell bodies of all those motor nerves, so it's big and fat and wide, okay? Then right in front of the gray commissure is the anterior white commissure. That's the white matter that connects the left and the right sides. The ventral and dorsal gray horns divide the white matter into four main regions, all right? You can see that, right? We have the ventral white column, the dorsal white column, and the lateral white columns. Now, why are they called columns? Well, notice we've just taken a slice of the spinal cord here, but the spinal cord, remember, is a big giant column that goes all the way up and down your back. So, in reality, those are big giant columns of white matter. So again, we have the ventral white column, the dorsal white column, and the lateral white column. And here's something I might ask you about again later. Why are the ventral horns wider than the dorsal horns? Yeah, they've got all those cell bodies of the motor neurons, whereas the dorsal gray horn has the cell bodies of the sensory neurons. Now, in the same way that nerves are bundles of axons that are out in the body, right, going out to your arms and your legs and so on. There are also bundles of axons that flow up and down inside the spinal cord itself. We call these, instead of nerves, we call them tracts. If they're inside the spinal cord, they're tracts. If they're outside of the spinal cord, they're nerves. But they're both bundles of axons, okay? So spinal tracts are the highways for information traveling between the brain and the body. Sensory tracts are called ascending tracts. They're taking information from sensory organs to the brain. We also call them afferent, remember? Can you see now, why do we also call them ascending? You can say ascending if you want to. I emphasize a just to keep it straight in your head. So why are they called ascending? Because think about it, they're coming in from the body, from your arms and your legs, and then they're going up to the brain. So they're ascending to the brain. So sensory tracts, just get this straight in your head. Sensory is afferent, and it's also ascending. All right. And in contrast, what do we have here? Motor tracts are descending. They're also efferent because they're going from the spinal cord out to the body. So we have motor tracts, which are efferent or descending, and sensory tracts, which are afferent or ascending. All right? We're going to be talking sensory and motor all the time, over and over and over again, and we're going to be talking ascending and descending and afferent and efferent over and over again. So get those terms really clear in your head. They're not going to go away. And the spinal cord gray matter is where excitatory and inhibitory pulses are summed. So what's going to happen here, the gray matter, those are the cell bodies. Remember how we talked about the axon hillocks where decisions get made? So we've got all these spinal tracts, but then the cell bodies are in the gray matter, and that's where impulses, either favoring the flow of information or inhibiting the flow of information, that's where they're all summed up, just like things were summed in the axon hillock. So that's the first basic part of the spinal cord. We'll continue with more spinal cord stuff in the next annotated PowerPoint.